Hi, everyone. I'm Dr. Mina, and it is great to be back in your ears for another episode of the Skin Reel. Now, we are at the time of this recording in springtime and getting into the warmer months. And that also means the time for weddings and wedding season. And I get a lot of patients coming in around this time prepping for either their personal wedding or they are perhaps the mother of the bride or the mother-in-law to be or in the wedding party. And of course, they want to look their best and they're looking for a way to kind of refresh, rejuvenate before the big day. So all this week, we are going to be talking about how best to get ready for these big life events. Maybe it's not a wedding for you, but maybe you've got a big graduation or you are going to be attending a graduation and you want to really look and feel your best. And that is where having a great relationship with your dermatologist can really come in handy. Now, when you're thinking ahead for these big events coming up, it's important to give yourself time. And that's because when we're dealing with our skin, things are not always immediate and instantaneous. And a lot of times we need to take things slowly so that we can really have a natural look and natural effect. And particularly if you have more pigment in your skin, we really have to be careful and move a little bit slower so that we don't cause problems like hyper or hypopigmentation. That's where the skin gets either much darker or conversely much lighter than the surrounding skin. So a lot of times it's better to take it slowly and do a little bit along the way rather than to come into your dermatologist the week before your big day and sort of expect magic to happen over those next few days. Ideally, when you're planning for a big day or a big event, you want to give yourself a minimum of a month and ideally even 2 months to prepare and prep your skin. So what I would recommend is if you have a big event coming up about 8 weeks before the event, make sure you have an appointment with your dermatologist, especially if you are doing something new or for the first time. Now, if you are a long-standing Botox filler laser patient, you and your dermatologist may have a great relationship. You know what works well for you and you know how much downtime you need for certain procedures. And in those cases, you may not need that full 8 weeks. But especially if this is something you are doing for the first time, which I find it is for a lot of my patients, plan to come in at least 2 months in advance to first have a consultation with us so we can talk about your goals, what you would like, and what's realistic in the time frame and with your budget. So that's number one. Give yourself time, come in, and first have a consultation. You may think that you need filler and your dermatologist may actually say, no, Botox actually, or botulinum toxin actually would be a better choice here. And your dermatologist may also recommend some sort of resurfacing procedure, either with a laser or a chemical peel. And you are going to want to make sure you have time to recover from that and make sure any redness can fade before your big day. This is especially important if you've never had these procedures before, because we're not totally sure how you're going to respond and how you're going to react. So it's better to give yourself a little more time than less time. Also, a lot of these procedures that we do, particularly with lasers, require multiple treatments. And so you want to make sure you have time to get those multiple treatments in before your big day. So give yourself plenty of time if you're looking to rejuvenate and look your best for that big day. If you are thinking about getting toxins or injectables for the first time, it's also great to give yourself plenty of heads up, plenty of notice, because if you have never had toxin before, it may feel weird and strange to you to not be able to raise your eyebrows or make some of the expressions that you normally do. And you may want the side effects to wear off a little bit for a little more natural effect before your big day. Also, depending on where you get it done and how much toxin you get, you may feel that actually your brows are very heavy and you may feel like your eyebrows have dropped and perhaps it's even harder to open your eyelids. And unfortunately, that is from either too much toxin being placed or being too low on the forehead. And you won't want that look on your big day. So it's good, again, to get your neuromodulator at least a month, if not two, before the big day. So you can make sure that you like it. And if you don't like it, it has time to wear off a little bit. The same is true with injectables like fillers. Now, if you are getting hyaluronic acid fillers, the great things about those products is that you inject it and the results are pretty immediate, which is really great for patients. However, same situation. You may get your lips injected and feel like you don't like how big they are, or you may get what we call the tear troughs under the eyes, and you may feel like you are too puffy from that. So you want to give yourself at least a couple weeks for swelling to subside and settle down and to make sure that you really like it. And especially if you've never had it before, I really like to start slowly. I don't want to overdo it, especially before a big day. And you want to give yourself time where you could actually go back and have some more if you want, rather than overdoing it all in the beginning. The other issue with anytime we inject something, we put a needle into the face, there is a risk of bruising. And you definitely don't want to bruise on your big day from your injectables. So again, giving yourself several weeks for that bruise to fade is really optimal and really ideal. Now, if you are thinking about more overall pan rejuvenation, then that's going to be things like biostimulants. And those, by the nature of how they work, require several weeks to even months and also several treatments for the full effect. So if you are thinking about getting something like Sculptra or Radiesse injected, then you want to give yourself a minimum of 8 weeks. And you may even want to come in a little bit sooner. I love a good chemical peel or a resurfacing procedure to really help people's skin look beautiful and glowing and radiant. And I find that this works best when someone is also practicing really good sun protection, of course, and using a vitamin A derivative like a retinol or tretinoin. That just helps prime the skin and makes the chemical peel or the laser procedure work more effectively and more efficiently. Now, you are going to want to stop these products about a week before any treatment, and then you are going to want to let your skin heal before resuming it. And while chemical peels and laser resurfacing can give excellent and beautiful results, sometimes there's a little, depending on what you get, you can have a little bit of swelling afterwards, and you can get a little bit of erythema or what we call hyperpigmentation, where your skin actually gets a little bit darker after the procedure. So again, better to give yourself ample time before your big day if you're going to do these procedures. And of course, with all these procedures, you really want to be vigilant about sun protection. If you come in tan, it's going to be really hard to treat you, especially with things like lasers. And you're going to be wasting your time and money because if you go in tan after your treatment, you risk burning and you really negate all the wonderful benefits that you just got from your procedure. That leads me to another point. I know a lot of people, at least back in my day, wanted to get tan before big events like a wedding or prom. And I have to say, I've been guilty myself when I was a teenager, but I definitely highly, highly, highly recommend that you do not tan, especially in a tanning bed before these big events. If you are looking for glowing skin, really glowing skin is just beautiful skin that you take care of, whatever color, whatever ethnicity and skin complexion that you have, and not trying to be something you're not, and really just embracing whatever color you are. But I get it. Some people really associate that sort of bronzy glow with vitality and health. And they want that look for their big day. Now, if you do want that look for your big day, then do it safely. There are really great self tanners on the market nowadays. And I think people now know to wear gloves when they apply and to be careful over thicker areas like your elbows and your knees, and maybe put a little moisturizer on those areas first so that they don't absorb the pigment and give a fake look when you apply it. But there's some great self tanners on the market, and that will definitely give you that glow you're looking for in a healthy way. And you can also get a spray tan. I get asked this question a lot. Are spray tans healthy? And yes, dermatologists have no problem with spray tans. It is a great alternative to getting a burn and getting radiation damage from a tanning bed or from the sun. So if you are looking for that golden, bronzy glow, then either do self tanner makeup or a spray tan. But please, please, please do not undo all your hard work getting ready aesthetically for your big day by going to the tanning bed. That is definitely a big no-no. Now, I know a lot of people really kick their fitness routine into high gear when they are planning for a big day, especially a wedding. And they focus on eating well and exercising. And the goal seems to be to lose weight. And of course, you need to do that months and months in advance if you are going to go about it in a healthy way. So you can't just plan to lose 10 pounds safely in the month before your wedding. So that's something that you are going to want to start thinking about and planning for months in advance. Make sure that you're drinking plenty of water. And again, a balanced diet is so key for healthy skin. If you are on a very caloric restrictive diet, your skin is going to show that. It's going to be dull, lackluster. It's not going to be vibrant, hydrated, and supple, and your skin will show. So you don't want to lose weight at the cost of having bad skin because you've done it in an unhealthy way with a fad diet or a very restrictive diet. So again, make sure you are getting plenty of fluids every day with water. Men should be getting about 3.7 liters. Women should be getting at least 2.7 liters of water at a minimum. Make sure that you are getting a mix of fruits and vegetables, that you are eating lean proteins, having healthy carbohydrates, complex carbohydrates, as well as healthy fats. Those unsaturated fats, things like olive oil, those are going to make your skin supple. They're going to really help prevent dryness and protect your skin barrier. So you really need all of this for healthy, beautiful skin, or it will show and you will not look as radiant and beautiful as you can on that big day. So it's great to think about your diet. It's great to try to get to your healthy weight and to exercise and weight lift and build muscle mass, but make sure you're doing it in a healthy way so that your skin will be gorgeous and beautiful. So of course, that's something you're going to need to start well in advance, months in advance, right before your big day. If you're thinking about doing any weight loss procedures, particularly liposuction, but also even cool sculpting, these procedures also take months for the result. I tell my patients when we're doing liposuction, it's going to take 3 to 6 months and probably more like 6 months for the full effect, for all of that skin and the swelling to resolve and for that skin to tighten up and for you to get your ultimate results. Same thing with cool sculpting. That skin is going to be very numb and swollen initially. And it does take months for the final result. So unfortunately, no quick fix with weight loss, even with liposuction and cool sculpting procedures like that. It just does take time. So those are things, again, you're going to want to be thinking about well in advance of your big day. And then any rejuvenating procedures, chemical peels, laser peels, I'd recommend doing those at least 2 months in advance just to make sure that A, you like the results, any erythema or redness has time to fade, as well as hyperpigmentation. And if you need subsequent treatments, you have time to fit those in. You'll also want to do your filler and toxin, maybe even like a dry run to make sure that you like the look and you are happy with the volume that's used and the amount of units that are used and how they're placed. So even doing a dry run 6 months in advance can be helpful. And then you can go in for your treatment dose before your event, even a month before, because you've done the dry run, you know how it looks and you like it. It's kind of like getting to do a dry run with your hair and makeup, right? You don't just go in for the first time to have your hair and makeup done. Actually, I think I did, but most people don't, especially if you are spending a lot of money and time planning your big event. It's also great to see your dermatologist well in advance of your procedure because they can also address any skin issues you may have. I know a lot of people struggle with acne even as adults, and perhaps they are self-conscious about maybe some hair loss. These all, again, take time to resolve. There's no quick fix, unfortunately. And getting into a good regimen is key. Your dermatologist can help advise you on certain prescriptions or things to use to improve your acne. And if you have any hair loss or thinning or balding, you will want several months to really give your hair a chance to grow and it's of any treatments. Again, nothing is quick and fast, unfortunately. Probably about a week or two. I would not recommend doing really anything new to your skin a week and probably even 2 weeks before your big day. So don't try out new products. Don't try out new creams because the last thing you want is to get, say, an allergic reaction to something you've been using or something new that you've never had before. And now you've got this itchy rash or you're swollen right before your big day. So really a week or 2 weeks before your big day, make sure you're not using anything new on your skin. And of course, you know that I like to keep it simple always with your skincare. So now is not the time to try out new things and see how you like it. Instead, stick with your tried and true routine, at least until you get through your big event. I do think it's fine, especially if you've done a dry run of toxin and fillers, to go ahead and get that placed about a month before, because then it will be at its maximum benefit by the time you have your big day. If you take care of your skin, take care of your body, take care of your health along the way. And I love little tweaks and little nips and tucks and injectables along the way. It really can stave off the feeling of overwhelm when a big event comes and you think, oh my gosh, how do I undo the past 10, 15, 20, 30, whatever years of my life to help myself look and feel my best? I wish everyone out there celebrating a big event or a big milestone in their life that they have a wonderful time and that they remember that beautiful skin really starts from within. And of course, the best accessory is going to be self-confidence. And I think when you feel good, it shows and it makes everything look better, including your skin. It has been so much fun talking with you all today and this week. And I can't wait to be back in your ears next week. We'll talk soon.